my name is Dakota, and I'm going to be your nurse today. I need to do a full body assessment on you. Is that okay?
Yes, ma'am.
Alright, can you tell me your name and date of birth?
Noah Moss, 11/25/97.
Do you have any allergies?
I'm allergic to erythromycin.
Okay, but you're not allergic to like latex or anything?
No.
Okay. Alright, so I'm going to start this off by asking you a couple questions. Can you tell me who the president is?
Joe Biden,
What year it is?
2021,
And what's today's date?
March the 3rd, 2021.
Alright, patient is alert and oriented times 3. So I'm going to get your vitals. I'm going to get your blood pressure first. Blood pressure is 120/80. Respirations are 16. Can you hold your arm out for me? Alright, so I'm first going to start by getting the radial pulse, and that is thumb side of the wrist. Alright, that is easily palpable. It is a 2+. Now I'm going to assess the brachial, so that is pinky side. That is easily palpable, 2+ as well. I would assess both of those bilaterally. Are you having any pain today on a scale of 0 to 10?
0.
0. Okay. Alright, now I'm going to start off by looking at your head. So the head is normocephalic. It is the appropriate size, shape. It is symmetrical. Can you tilt your head like this? And then can you roll? This patient has full range of motion of their neck and they have full control of their head. I'm going to start with your hair. It is evenly distributed. The scalp is white. I don't see any lesions, masses, any abnormalities. Do you have any pain when I do this?
No, ma'am.
Okay. Use the appropriate color. My gloves. I'm going to put that in the trash. Now I need to palpate your sinuses. I'm going to palpate your maxillary. Tell me if you have any pain or tenderness.
No, ma'am.
In this your frontal, any pain or tenderness?
No, ma'am.
Okay, now I'm going to assess your temporal artery. It is easily palpable, a 2+. I would assess that bilaterally. Now I'm going to look at your ears. So they are symmetrical, the appropriate size, appropriate shape. I would assess for any drainage, lesions, any abnormalities, masses. I don't see any of that. So I would assess that bilaterally. Okay, now we're going to do what we call a hearing test. If you could, can you please cover one ear and look that way? I'm going to go behind you, whisper a word, tell me the words you hear.
Yes, ma'am. Window.
Okay. Cranial nerve 8 is intact. So now I need to do your eyes. Okay. So can you look at me? And now look behind me. Alright, so there is accommodation. The eyelashes and eyebrows, the hair on those are evenly distributed. I don't see any missing hair. I don't see any redness. Can you close your eyes? The external structures, I don't see any bruising, so that is good. Alright, open your eyes. Alright. Pupils are equal, round, reactive to light, and they accommodate. They are, look at me if you look here, please. They are approximately 4 millimeters. They are equal in size, shape, and symmetry. Alright, can you follow my pen? Don't move your head, just follow with your eyes. Cranial nerve 3, 4, and 6 are intact. Alright, can you smile? Can you frown? Can you puff out your cheeks? And can you raise your eyebrows? Cranial nerve 7 is intact. Alright, now I'm going to look at your nose. So it is symmetrical. Can you tilt your head back? Patient has an intact septum, moist membranes. It is pink on the inside. Can you cover one nostril and breathe? Okay, now cover your other nostril. Alright, breathe. Okay, now we're gonna do what's called a smell test. Can you close your eyes and close one nostril? And I'm going to wave something under your nose. Tell me what you smell, okay?
Smells like alcohol.
Okay, cranial nerve 1 is intact. So now I'm gonna assess your mouth. Let me wash my hands. While I'm putting on my gloves, can you stick your tongue out? Can you move it side to side, up and down? Can you say I? And can you swallow? Cranial nerves 9, 10, and 12 are intact. Alright, stick your tongue back out. The tongue is pink, it is moist, it is rigid. Okay, you can stick your tongue back in your mouth. Open your mouth. Now, patient has approximately 32 teeth. They are in good condition. I don't see any dental caries. The buccal mucosa is pink. The gums are pink. Stick your tongue out. Okay, no tonsils are noted. Take that off, put that in the trash, wash my hands. Okay, so now I'm gonna assess your neck. I don't see any jugular vein distension, any pulsations. I'm going to assess your carotid, okay? Carotid is a 2+. It is easily palpable. I would assess that bilaterally. The trachea is midline, and you can roll your neck, right? Okay, patient has full range of motion. All right. So now, can you tell me if you have any pain or tenderness upon touching?
No, ma'am.
Patient says no pain or tenderness. All right. Patient has no labored breathing. Go to the side. They have a 2-to-1 ratio. If you don't care, can you stand up for me? I need to listen to you. Okay. 1, 2, 2, 3, 3, 4, 4, 5, and 5. Okay, and can you turn around? All right. 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, 8, 9, and 9. Okay, and keep facing this way. So I'm going to go down to the 10th vertebrae. All right, and can you breathe in and breathe out? All right, patient has equal chest expansion. All right, can you turn around and face the camera? All right, so now I'm going to listen to heart sounds. No adventitious lung sounds were heard. Now I'm going to go to the heart. All right, so on the right side, second intercostal space. Second intercostal space. On the right side, near the sternal border, we have the aortic valve. Okay. And on the second intercostal space, left side, near the sternal border, we have the pulmonic valve. The third intercostal space, near the sternal border, the third intercostal space near the sternal border on the left side, we have the Erb's point. The fourth intercostal space on the left side near the sternal border, we have the tricuspid. And then the fifth intercostal space, mid-clavicular, we have the mitral valve, and I'm going to listen to the apical pulse for 1 minute. normal sinus rhythm was heard. The heart rate was 60. If you don't care, could you go ahead and have a seat? Alright, so this next part, I'm going to be looking at your arms. Can you stick your arms straight out? Patient's arms are symmetrical. Can you rotate your wrist? Okay. Crepitus noted, no pain or tenderness.
No, ma'am.
Patient has 4 range of motion of the wrist. Flip your arm over. Okay. No crepitus noted, no pain or tenderness.
No, ma'am.
Patient has 4 range of motion of their elbow. And then can you roll your shoulder? Roll the shoulder. Alright, no crepitus noted, no pain or tenderness.
No, ma'am.
Okay, patient has 4 range of motion of their shoulder. I would assess that bilaterally. Now I'm gonna do, your hands. Can you squeeze my fingers? Okay, patient has grade 5 strength in their hands. Now, can you, push up against my hands? Okay, push down. Grade 5 strength. Hold your arms like this. Alright, now push against me. Okay, now pull. Alright, so patient has grade 5 strength in their arms and their hands. I would assess that bilaterally. Can you do this? Patient's fine motor is in contact, or is in, it's connected. Okay, now, if you don't care, could you go ahead and lay down this way? Alright, so upon looking at the abdomen, it is flat, it is not distended. Do you know the day of your last bowel movement?
Yesterday.
And have you had any urinary changes?
No, ma'am.
Okay. So I'm gonna listen to the bowels. So starting at the belly button, I would go diagonal. I'm gonna start in the right lower, right upper, left upper, left lower. Patient has normal active bowels. If I did not hear any bowel sounds, then I would listen for 5 minutes in each quadrant. Now, can you tell me if you have any pain or tenderness?
No, ma'am.
Alright, you can go ahead and sit up. If you don't care, can you straighten your legs out? Okay, patient's legs are symmetrical. Can you roll your ankles? Okay, crepitus noted, no pain or tenderness.
No, ma'am.
Patient has 4 range of motion of their ankle. Alright, now can you lift your leg and bend it back towards you? So bend here, back. Patient has 4 range of motion of their knee, no crepitus noted. Can you take your leg and best you can on the couch? Patient has 4 range of motion of their hip, no crepitus noted. Do you have any pain or tenderness?
No, ma'am.
Okay, I would assess all of that bilaterally. Now I need to do the strengths. So can you push against me? Okay, now push against me. Patient has 4 range of motion, or patient has grade 5 strength in their leg. So now I need to do your feet. Would you care to take your socks off?
Yes, ma'am. Both or just one?
Right. I'm gonna start this off by, can you like raise your legs up? Okay, now can you push against my hand? Okay, now push down. Patient has 4 range of, or patient has grade 5 strength in their foot. I would assess that bilaterally. So now I'm going to look at the bottom of your feet for any lesions, masses, any abnormalities. I don't see any. I'm gonna check in between the toes for any fungus. I don't see any. Patient has all of their toenails. Okay, I would assess that bilaterally. So now I'm going to do the dorsalis pedis. So it's big toe, go down, it's on top of the foot. That is easily palpable. It is a grade 2. Now I'm going to do the posterior tibial. That is easily palpable. It is a grade 2 as well. I'm going to assess for any edema, and I would assess those pulses bilaterally. I don't see any edema in the patient's legs. Don't see any edema in the patient's legs, so it's just that bilaterally. All of the range of motions and all of the strength testing would have done bilaterally, as well as all of the pulses. So I'm going to put this in the trash, wash wash my hands, I would throw away all of my stuff, and I would document, and that concludes my physical assessment.